So welcome everyone who's filtering in. Thank you so much for joining us this morning. My name is Sarah Cox. I am here from Innovation Super Network, and I am really excited to introduce you to the second challenge of the Challenge Northeast programme and to tell you about the work that has gone on in getting the programme to this point. So thank you so much for joining, and thank you to our panelists and speakers who are going to be sharing with you today the challenges that they've faced in their organisations in delivering services within the home across a variety of sectors. And we're really excited to get your input into the solutions that are needed to ensure that our fellow community members are safe, that their needs are met, and that we're able to adapt to the new challenges that COVID has thrown up across the region. So first, I want to quickly introduce the agenda. We have a really interesting speaker lineup, and I'll be speaking a bit more about how we have put this event together and how this challenge has been formulated for you to respond to. We have Christine Paxton from Karbon Homes, Jason Lowe from Beyond Housing, Steve Dacre and Richard Hines Cooper from Northern Gas Networks, Steve Parry from the NHS, and Lisa Connell from Northumbrian Water. And we have put together our Challenge Northeast team, a fantastic team that I've had the pleasure to work with over the last few months. We've been putting together this programme in working with the local region, trying to understand what are the most pressing challenges that have been caused by COVID, and where can we invest Northeast LEP's money in developing some solutions that will catalyse the right action around the problems that we most need to solve. So we have a great collaboration here from Innovation Super Network, Sunderland Software City, our colleagues at the LEP, and also Procter & Gamble. And we've been working quite closely with Challenge supporters who you'll get a chance to meet today. So I wanted to take a quick minute before we jump into the interesting part of the session to introduce exactly what the Northeast Challenge programme is, why we are all here today, and hopefully how you can benefit from this. So a Challenge Northeast programme is effectively an open innovation programme. We recognise that COVID has massively disrupted multiple aspects of our economy, industry, our communities, our kind of social networks and our lives. And we wanted to bring together the kind of brightest minds of the region to figure out where is it we can focus our attention, where is it that we can focus on bringing your kind of talent and your insight and solving your problems in order to make our region stronger. And there are a few aims that we are hoping to tackle through this challenge. We want to have real impact. We want to bring together the right organisations to develop solutions that will work in a relatively short period of time. This programme has been developed to give you the funding that you need to quickly test if your concepts work, if they work for the challenge that we've identified, and then help you take those forward and scale those out if they have the impact that you hope that they will. And we really want to de-risk the development of these solutions for you, for those of you who are listening in the audience today, who might have some really innovative ideas or existing concepts that you want to put to use and to test out. We appreciate how all of our organisations, to a greater or less degree, have been disrupted, how fatigued we all are with the kind of the current situation, how uncertain things are with furlough, with disruptions to our service delivery, and maybe an uncertain future ahead. We want to make this as easy as possible for you, and we will be talking about how we've done that through the process and the funding that's been made available. We want to make sure that the organisations who are joining us today, the challenge supporters who have these problems, and the organisations that are joining us are mere representatives of the wider group that we've engaged with. And those of you who are listening who might be able to develop solutions to these problems all benefit from this programme, that you get more out than you put in. And we really hope that we can enable kind of a collaborative and what I would call kind of a design-led approach. We want to focus on what is the impact we can have, what are the users and the communities that we want to help, how can we create solutions that really meaningfully create impact for these groups and that work in practice by working closely together. And finally, we want to promote economic, social and environmental benefit. When you are putting together your concepts, please do think about the business model behind it, the chance to scale this up, the kind of return on investment that you might be able to generate over the longer term through this. but also think about the social and environmental impact. We really want to see a real range of solutions coming through. We don't necessarily just want to see all digital solutions or all product-based solutions. We're keen for organisations from community groups or charities or other organisations to come forward and come forward with solutions that they really have been informed by the needs of the communities that we're looking to help. So probably best to give you some more insight at this point into exactly what the programme is going to involve. So up to this point in October and November, we've been working to scope the challenges that have launched. This is challenge number 2, adapting in-home solutions. We were very happy to launch challenge number 1, which is about the disruption to in-person events and potential solutions to that challenge yesterday. And we've been working with research organisations in gathering the work that's been done in scoping the impact of COVID on the North East region, but also working with key stakeholders to actually understand what's going on the ground, what are their key priorities, what are the problems that they face and are going to continue to face over the coming year, and where are the unmet challenges that they've addressed. So we all understand that organisations are not standing still. We've all had to come up with ad hoc solutions to the challenges that we face. And what we want to do through this is to give you an opportunity to understand the work that key organisations have already done and where they're already looking, but also their unmet needs so that you can effectively respond to those. And if there are any organisations in the audience or watching this on the playback that have not yet been involved in the challenge, they didn't get a chance to attend our roundtable where we started to scope these problems. We had quite a wide audience from housing associations, local authorities, the NHS, social care services, utilities providers, community groups, a wide range of organisations that deliver services within the home and who've seen massive disruption to their services. If you yourself are impacted by this challenge and want to speak to us about getting involved in the programme, testing out some of the solutions that are coming through or being kept up to date on the solutions that are being supported, please do get in touch with us because we'd love to have you involved. We are now today, 10th of December, launching our phase 2, which is the launch of the challenge. Having defined where are the areas of unmet need, we really want to now engage you to be thinking about what solutions do you believe from your expertise could be developed to address this challenge. We are asking for expressions of interest, and I'll talk about that more at the end of the session, exactly where you can get the form and what questions we'll be asking. But we have aimed to make this as light touch as possible, both in terms of the application and in terms of the reporting. You can apply for up to £5,000, 100% funded, to develop a concept between January and March. And we will be asking at the end of March to pitch to an independent panel the concept that you've developed and tested, with the chance of being allocated or chance to apply for a grant of up to £40,000, again, 100% funded, to help scale up that solution at the end of this process. So like I said, we've tried to make this as easy as possible for those of you who are interested in applying. All we effectively want in this first phase, when we're going to be kind of taking in your expressions of interest, is what if it's your concept? How is it innovative? How does it address the problem? And why are you the right team to develop it? And like I said, I'll be talking about that a little bit further at the end of our session. So I'm really excited to introduce you to the organisations that we have here. As I've mentioned, we have worked quite in depth to this point to really understand what the region's key stakeholders and communities who deliver in-home services and what the crucially the groups and the users that they represent and they serve. What areas of focus do they need help in? Where do we need your innovative thinking and your kind of maybe cutting edge technology or user focused solutions? Where do they need us to be looking to solve these problems? And the key areas that were coming out of this area were: how can we increase the safety, confidence and trust of external visitors entering the home whilst we are still having this impact of COVID? And I appreciate we're all very excited and grateful, I believe, to recognise that we're now rolling out the vaccine in the UK, which is obviously kind of a great light at the end of the tunnel, but we do recognise that there's going to be a long tail end of this, both in terms of inoculating the population, but also the changing behaviours and maybe anxieties of certain individuals going forward. So we are very conscious of the fact that this work is still needed, and we also want solutions that will kind of address kind of ongoing problems that have been exacerbated by COVID as well. We also identified that we want to increase the effective use of digital technologies, which may not be understood or used by many end users, and how we could effectively do that, as well as understanding or exploring different communications methods for different user groups who we need to engage, who are most in need of the services that are delivered. And finally, how can we ensure that in-home service standards remain high despite significant increases in demand and service disruption? There's been a lot of disruption in terms of staffing, in terms of access, in terms of safety of staff going out into individuals' homes with the ability to do so. How can we ensure that the users that we're serving, particularly vulnerable users, are getting the services they need, and that we can continue to address their needs and ensure that the problems that they have and that they need help with do not get worse and worse over this kind of period and end up with chronic or really difficult to solve problems when we come out of the COVID lockdown or restriction periods, either later this year or in 2022. So finally, I'm really grateful for the organisations who are attending today as representatives of the numerous different types of organisations that have helped frame this challenge. As I mentioned, we have the NHS, Karbon Homes, Beyond Housing, Northern Gas Networks, Northumbrian Water, and the Academic Health Science Network, to give you really an insight into the challenge that we're facing. And we really want this to be an interactive session as well. So ask your questions, put them to our panel. We'll be having a series of talks, but then also what we really want to get from all of you is your questions that you need answered so you can start to formulate your solution to these really complex problems. Use the Q&A box to pose questions to our panel. If you have any comments or queries, you can place them in the chat box, and our team who are helping to facilitate the session will be really keen to get involved and to answer any questions that we can. And finally, we really want to get your help in promoting this challenge. We really want to get as many solutions as possible to support a wide suite of solutions to this complex area, and to kind of really support those and see which ones can work and scale those up so they can be real benefit for the region, both in terms of the businesses that can grow, but also in terms of our challenge supporters and key service deliverers who need your support in tackling this problem. So please do share this event. I think we'll be live tweeting this one. Use the challenge any hashtag to share any content, share it in your networks. Then we'll be, as you'll see with this, we've had to respond very quickly. It's been a very rapid process in getting to launching this event. So there may be really well-placed organizations based in the Northeast that do not know that this is happening. We will be making the recording of this available as soon as we can after this session. And please do share this with your colleagues and collaborators as widely as possible. So firstly, I would like to invite Christine Paxton from Karbon Homes to talk about the impact that COVID has had on the service provision and their delivery, particularly with the users that they are most keen to engage with. So Christine, if I can pass the virtual mic over to you.
Thanks very much. I'm just going to share my screen. I'll do that bit first. And hopefully that will be working for everybody. No? Sarah, is that working?
Yes, it is. If you click on slideshow view, yeah, that's fantastic. Thank you.
Fantastic, great. Thank you very much. So just a quick introduction. My name's Christine Paxton. I'm the Assistant Director for Business Development and Communications at Karbon Homes, and we've been working with the Innovation Super Network for a few months now, and finding their approach to open innovation and collaboration just really great. So really looking forward to today. Just to provide you with a bit of background, I think it's worth saying there's a number of other housing associations that are involved in this challenge, and my slideshow and my presentation is probably going to hopefully give you an overview of the sector as a whole, because we're all facing very similar challenges. And Jason later on will be focusing on potentially one of our core customer bases that we're finding particular challenges with as well. So hopefully we'll find that there's some complementary connections there. But in terms of Karbon, just a bit of background about us for those who don't know us or housing associations in general. We own or manage around 30,000 properties across the Northeast, from Berwick down to Yorkshire. We have over 800 employees in the Northeast too. We've a very ambitious development program, so supporting the Northeast in developing new homes. But we're more than about homes, we're also a community organisation, and we support our customers and residents in many ways, which we'll talk a little bit about later on. Again, a lot of commonality across the sector. Around the wider support that we provide beyond housing, repairs and maintenance too. I thought it'd be useful to give you an overview of the impact that COVID has had on the sector as a whole. Housemark is a membership organisation that provides analysis and solutions of performance across the whole sector in order to drive solutions. And they produced a report following some data analysis in September, October time, and they looked at performance indicators across 147 providers across the country, of which Karbon were one of the 8 from the Northeast. And what it showed was, and particularly as of the 31st of October, almost 70% of social housing providers were under additional restrictions, and for the Northeast, as we all know, it was 100%. So you know, the impact from COVID in the North and in housing sector has continued throughout. Finances across the sector, over half of the sector feel that they will be in a worse financial position by the end of 2021. 40% of the sector are expecting a squeeze on margins. Rent arrears, which is where we generate our income in order to deliver our service, forecast that by the end of the year, current tenant arrears will be over 20% higher than it was in March last year. And then from a kind of delivery perspective, our trades colleagues, our frontline staff, the ones out doing the service that we provide across the sector, sickness peaked at the beginning of pandemic before falling back over the summer. And in September, the sector saw a 13.3% increase as the second wave held. So managing sickness has been a big problem for us and other housing associations. Repairs. Non-emergency repairs had to be deprioritized, but you know, managing the backlog of that is an ongoing challenge. And then lettings as well, so letting the empty homes. Activity has recovered since May, but turnover is now turnover is now above pre-pandemic levels, but it's estimated that the sector's lost 31.5 million overall nationally in income due to the empty properties. So again, a big challenge that we're all facing. So coming to Karbon specifically and what we've been doing and the problems that we've been facing through the pandemic. So dealing with the backlog of repairs and maintenance, that's been one of the main things we've been thinking about and looking at solutions for. A lot of those solutions are internally driven, and we've been doing things like rescheduling and reprioritizing, outsourcing. We've also launched our online portal to help drive self-service, and that's had a really incredible take up during the pandemic. Another major issue has been complying with our safety obligations, which has been harder due to COVID-19, so electrical and gas servicing and repairs. What we've been doing there is lobbying to try and provide some flexibility around timelines and deadlines. We've also been driving more communications to customers to make them feel more comfortable and understand the importance of those checks and repairs. We've been prioritizing those visits over others, and really just making customers and colleagues feeling safe when we do have to go into their homes. We've been dealing with increased sickness and isolation of staff. Again, what we have to do there is, again, reschedule, reprioritize. We've been driving mental health and wellbeing campaigns across the business as well internally. And again, we've had to outsource when we've been struggling with capacity. Dealing with no access issues, one of the main challenges that Innovation Super Networks flagged, that is a real challenge. And what we've been doing, you know, when customers aren't feeling comfortable with letting us into their homes, is doing a number of communication campaigns, driving customer service calls. We're also doing some experimentation though with artificial intelligence for diagnostics, which we'll talk about a little bit later. We've had supply chain problems. So our supply chain who provide us with plasterboard, furniture, that kind of thing, similarly have been impacted by COVID. And I think Brexit's going to continue to make that very difficult for them and for us. Again, what we do there is we prioritize, drive communications, keep people informed, and build strong relationships with our suppliers, but the problem doesn't go away. And then from a house sales and rent viewings perspective, again, that's difficult. So what we've been doing now is doing more video content, and again, a lot of communications, making sure customers and colleagues feel safe. Broader than that, what we've been thinking about and problems we've been facing is more the social and community aspect. So what we've been challenged with is identifying who needs more support. We've been doing a lot of communications with our customers to ask them to call us or contact us if they do need help. There are a number of our customers that live alone, that don't have great access to transportation. We've been encouraging referrals from our partners to support them. We've also been doing a lot of work on volunteering for calls, which I'll talk about in a moment, and pushing our digital channel just to help people access and communicate with us in different ways. Loneliness and isolation, I know we'll be talking about vulnerable customers later on. You know, that's been something we've really focused heavily on. We have a befriending telephone service that we own and run ourselves, and that's supported through volunteers, and we've seen some great take up from that. Customers are facing massive challenges with universal credit. If they're losing their jobs, they're transferring onto universal credit for the first time. So we've been giving them lots of money advice and guidance. Again, that's, you know, resource heavy, and driving a lot of communications there as well. We've also found that customers are struggling with employment. So we have an employment team that works with partners across the Northeast, and they've been giving employment advice, and also we've been exploring the Kickstart program. Field staff engagement, that's a really interesting one for us, which is around thinking about our customer facing staff, our frontline staff, and how we continue to make them and help them feel engaged and supported through everything that they're doing. And also something we'll talk about in one of our main challenges is the training that they need, which is ongoing training, which can be difficult now. They can't do classroom-based training. And non-essential visits have stopped. So what are we missing? What we've been reflecting on is what are the residual impacts of us not going into people's homes as regularly? What are the community issues that we're missing? What are the antisocial behaviour issues that we're facing? What property issues are we not finding out about soon enough? Again, we're overcoming that by increasing our telephone calls, communications. We've also produced a customer magazine, a special edition throughout the summer period. So there are ways that we're trying to support that, but there are ongoing challenges. So some of the things we've done throughout the pandemic to support the challenges are, as I say, we've been giving a lot of attention to our socially isolated customers through our Silver Talk befriending service. We've also been giving advice to our customers and supported over 1,000 of our customers who are struggling from a financial perspective. We've been delivering our emergency repairs and prioritizing those. And we've been helping and contacting our older customers on a daily basis. So yeah, again, lots of similarity you would find across other housing associations too. The challenges that we're still facing that we probably need help with, and you know, at a more granular level, are these. So how might we overcome that property access problem? You know, we're really interested in that challenge and debating that quite regularly. How might we offer remote video assistance and improved repair diagnosis? How might we keep our workforce skilled and compliant in the field through training when they can't come into the office or into a classroom? How might we improve digital access for our customers, both in terms of availability, broadband availability and cost prohibitors, and skills? Providing them the skills and confidence to be able to access from a digital perspective. How might we identify those that need the support more and connect with others in the community from a partnership perspective to help provide it? And how might we keep our field-based frontline team engaged, safe, and facilitate two-way communication and team spirit? So those are some of the how might we's. You know, there's loads there, but those are the things that we think collaboration can really help with us. And that's me.
Thank you so much for that, Christine. What I'm going to ask is that our audience keep their questions for our Q&A panel, which will be at the end of the talks. Please do take notes as we're going through this. Obviously, Christine's given us a huge amount of information there, some really interesting framing for these, for the talks that we've been looking at. And yes, I think some huge questions there. We're really keen to get our audience and those of you watching back responding to these. We will be sending the slides out. We've put some detail in the chat, and start to have a think about kind of your thoughts around this, questions that you want to ask of our panel. And just to highlight as well, the panelists that we have representing the challenge here, they are some of the challenge supporters that we've engaged. Whilst you may kind of listen to some of the input that you hear today and want to respond to a specific organisation, what we're really trying to do is to find to support solutions that have multiple applications. So there are multiple areas in which you could apply the solution if it works after you've tested it out through our funded programme. So have a think about what you hear today, but you also might have ideas from companies you currently work with, or knowledge you have of users who are affected by this challenge and need support. So really great talk, Christine. Loads of detail there. Really excited to ask you some more questions. And I'm really excited as well, secondly, to ask Jason Lowe to take the mic, as it were. Jason is from Beyond Housing, and we'll be sharing some additional detail there into particularly, I think, the impact that maybe more vulnerable users have had, and adding to some of kind of Christine's thoughts from a housing association point of view.
Thank you, Sarah. Just bear with me. It's the awkward point, isn't it, where I go through the process to share my screen.
You just need to kind of vamp a little bit while you get the slide deck set up. That's great.
Colleagues, see that fine?
Yeah.
Thank you. Thanks, Sarah. And good morning, everybody. As I've been introduced kindly, I'm Jason Lowe, and I'm Head of Independent Supported Living at Beyond Housing, and it's an absolute pleasure and a privilege to be asked to attend this morning's event. So thank you very much for having me. And in what is a very, very neat segue, I think Christine has very much set the context, set the very real backdrop that we as social housing providers are working in, and many of the issues that are core to our business, which have been massively magnified in the last 10, 11 months with the onset of the pandemic and the management of services throughout what has been a very difficult and continues to be a difficult and challenging period. So some of the sector-wide information that, some of the information that Christine shared in relation to carbon, much of that is very much shared pretty uniformly across the sector, and Beyond Housing is no different, albeit we're an organisation which is probably half the size of Carbon, around 15,000 homes, but certainly some of the trends and themes that Christine has pushed out, we're familiar with, and we're managing, and we're working through. What I wanted to do was use the opportunity to maybe just focus in a little bit more into what is a core service here at Beyond Housing, and around how we deliver independent and supported living services for our more vulnerable customers who may be frail, older, have a disability, just a general vulnerability, whether it be mental health or physical. And then talk a little bit about what that looks like in terms of current service delivery, and the challenges and the risks that we're constantly managing, which then opens up a bit of a, well, how might we continue to work through those risks and those challenges. So in terms of service context, and I'll just make the point now that my presentation is quite visual, so I'll be talking to some pretty pictures. I hope that's okay with you guys. But in terms of service and service delivery, our independent living service is very much premised on a platform of assistive technology, and the use of assistive technologies that we deploy into our customers' homes, tailored in most cases to their individual circumstances. And that technology is an enabler and a connector for them to remain independent, live a safe and secure life. But that technology, either through manual activation or through the technology being alert to something happening that shouldn't, or something not happening that should, being able to call through into a 24/7 monitoring centre. Talk a bit more about that shortly. And in terms of supported living, this is very much about where we are in providing supported housing accommodation in the community, which has care and support services on site wrapped around that individual. So again, there is a degree and a focus on an individual being able to live an independent life, have their own apartment, have their own quality of life, but have the ability to be able to be supported and cared for in that environment in a way which reduces the impact of admissions to residential care, nursing care, and or hospital. So I've used the phrase assistive technology. What do I mean by assistive technology? Well, our assistive technology platform is one which spans a range from the good old-fashioned pull cord and red button that many of you will be familiar with, and how that technology has been deployed in communities for many, many years, but which has become much more advanced and much more sophisticated in terms of being able to manage and monitor issues around dementia, medical conditions around epilepsy, environmental concerns and issues around CO and CO2, temperature extremes, lifestyle behaviours connected with forgetfulness and the aging process and dementia, sensors which can alert to people leaving the property and not coming back, getting out of bed during the night and not getting back into bed. And all of this technology is very intuitive, which builds up an understanding of lifestyle and lifestyle behaviour, which is also able to alert if there is something happening that shouldn't be, or something not happening that should be. So the assistive technology platform is increasingly sophisticated. And again, the how might we question runs through around how might that technology continue to develop, particularly into the more telemed and the telehealth scenario. Context-wise, we deliver independent living services into our communities, and we support over 9,000 vulnerable, older, frail customers in and around our operating environment. Not all tenants. Many are tenants of Beyond Housing. About a third of our tenants are connected into an independent living in some shape or form. But many of those customers are living in their own homes, in the community, receiving that additional help and support, so that they can manage their independence in a way which perhaps has a positive impact in terms of their well-being, and a positive impact in terms of the social care and the health sector as well. But over 9,000 customers currently being supported in the community through our independent living services. That just depicts some coverage, very much a cluster here in the sort of Tees Valley, south of Tees, a little bit north of Tees. Because the Beyond Housing footprint runs down to Scarborough, Filey, we have coverage down the eastern seaboard, as well as the Hambleton footprint of the North Yorkshire county. Again, we've been using through the COVID period, if ever there was a time when we've been challenged, this has been it, and how technology has stepped up and stepped in to be able to ensure our more vulnerable customers have remained connected in ways which have been very, very important to many people, because those connections may not have been there for many of our customers in the traditional sense around next of kin, carers, etc. So technology as a connector has been really, really key during this COVID period. The technology works in a way where there can be a manual activation, or the technology can activate an alert itself, which comes through to a staffed 24/7 control centre, where that call handling advisor can triage a response to be able to deliver the right service to that customer back into the community. And this really leads me into the key part of my talk, and I'm conscious we haven't got a lot of time. But it's about understanding clearly what the key risks and what the key challenges are and have been, and constantly asking the how might we, because with or without COVID, these are the issues that independent living services are faced all of the time. Clearly, as I've described, it's an extremely important lifeline service for many vulnerable customers. In many instances, it can be a service which is the difference between life and death. In the region of 147,000 calls have been received from customers and customers' assistive technology equipment in the months since March the 20th, when the country pretty much went into lockdown. So we're talking extremely high volumes of alerts and calls coming through the assistive technology platform, all of which create an understanding of the need to do something either for the customer or a response required in relation to what the technology is telling us. So the quantum here is significant. And what runs throughout the service delivery constantly are risks around financial, around staff management, staff deployment, very much the customer interaction, customer support, how the technology is working, how the technology can work harder, how we can have a mind very much towards digital transformation. We know that there's a significant challenge to look at analog systems which are moving and will need to transform themselves into digital platforms as a result of the analog to digital switch due for 2025. And then what sits behind all of this is something that Christine touched on as well, is that through regulation, through compliance, through performance management, how can we continue to maintain the quality levels expected? And just to pick out in no particular order, I think particularly in relation to staff, we face significant challenges. Again, Christine touched on some of this, that we've had to keep our staff safe. We've had to make sure our supply chains have provided sufficient levels of PPE. We've had to make sure that even when our staff are responding into the community and going into a customer's home as a result of an emergency alert, then they have the right risk assessments, the right safe systems of work, the right PPE to be able to do that in a way which meets their expectations, but also meets the customer's expectations. And again, we had to work much harder with customers. Understandably, many customers have been reluctant for anybody to come into their home, but in some instances, we are the first responder. This service is the first on the scene, and may well lead to a triage decision, which could call an ambulance or another part of the health system. So there are occasions where we've had to respond, but equally at times understand that some customers may not want us to be in the property as often as we would be. So how have we been able to flip that around? So we've been able to then flip that around and use the technology to provide more outbound calls, to be more proactive in contacting customers to see, how are you, more welfare driven. But again, that's a challenge. And how can we do that better? How can we scale that up in a way which still remains efficient, but also safeguards that customer's well-being and requirements? From a financial point of view, clearly COVID has placed financial pressures on many organisations across all sectors. These are services which are service chargeable. So the customer quite rightly wants to receive a service and feel that they're getting that value. But equally, some of the issues that we're working through here means it's costing more for us to deliver those services. So how can we constantly keep an eye on the value for money and the efficiency angle? In terms of customer and technology, what we've also been able to maintain, which has been really important, is our organisational support. And both health and social care expect providers like us to be able to still be responsive and deploy equipment in the community. That's been a challenge, but we've been able to continue that. We've still been able to continue to access customers' homes and install and commission technology to enable the service to continue. Our thinking has had to broaden. We've been able to do that in some instances in a more plug and play, remote guidance kind of a way, where some customers haven't wanted us, but we've been able to provide detailed support and advice as to how they can commission and set their own equipment up, which has been quite successful in some instances. So again, being a bit more innovative and creative in how we get the essential service to the customer in these difficult environments, in difficult times, but in a way which meets their requirements, but still delivers us, ensures that we deliver the right output and right outcome. Digital, the how might we? Well, the world of digital is just mind-blowing, and it certainly is in relation to the independent living and the assistive technology sector as well. A lot of the assistive technology sector delivers services through the analog telephone platform. We still do, although we're increasingly moving to more digital. But how might we think about transforming all of our services from analog to digital? There is a push to do that, but there are some amazing innovations which will not only improve effectiveness, we'll also open up the opportunity to be more creative with technology, to support people to live safely and independently in their own home, but also for us to be able to do that more efficiently and more robustly on a digital platform. And then finally, around quality, just because there's been a pandemic and just because we've been working through COVID conditions, that should not have and has not allowed us to take our eye off the ball in terms of regulation and compliance and performance management. And my service area here, along with many that Christine alluded to, we've been committed to that. And it's absolutely right that we're still holding onto our quality assurance standards, our compliance standards. Again, just to provide some context, the 147,500 calls which have come through our assistive technology system since March, all of those were picked up and handled, and the customers connected into a service operator within 60 seconds, over 98% in over 98% of occasions. So that's a huge effort from a staff group, which itself has been placed under pressure to continue to deliver a high volume service back into the community for our more vulnerable customers in a way which enables them to have still maintained their independence and then maintain their safety and their well-being in their own homes. So, as is clearly a theme here, the how might we, and I think for me, I'm thinking, I'm obviously looking forward to colleagues in the meeting this morning to think about how might some of these risks and challenges, which are real and they are here and they are being managed, but how might some of these risks and challenges be even more innovatively and creatively met with new ways of working, new systems, and some new innovations. So that's
Thank
it.
you so much, Jason. That was really, really insightful there. Some, as I'm sure the audience will be recognising, there's some really meaty problems to dig into, but problems that are shared across the range of organisations that we have here today. To get the most out of our time, I will pass straight over to Stephen Dacre of Northern Gas Networks. I'm sure there's a lot of relevance to some of the things that Jason was talking about there that you can jump onto. And Stephen will be talking to us about how NGN are meeting their most vulnerable customers' needs.
Good morning, everyone. I see Richard, we're going to do some introductions, but I don't know where Richard Hinescoop has gone.
Unfortunately, Richard just got pulled away. He was hoping to join us, but we will, I'm sure, Stephen, you can give us all the insight that we...
Oh, absolutely. So good morning, everyone. I'm Steve Dacre, Customer Experience Development Manager at Northern Gas Networks. And I suppose the title, I'm not using slides or anything like that. So I guess the topic of conversation for us is Northern Gas Networks and how we're working with customers in vulnerable circumstances and vulnerability as a whole. And I guess one of the things for NGN is actually recognising that vulnerability isn't just limited to physical. At the moment now, it's for us recognising that anyone can be vulnerable. Certainly during this COVID pandemic, is that vulnerability is far-reaching, whether that be temporary, that actually people can pass in and out of vulnerability. So again, what are we doing to tackle vulnerability? And I guess the research that we did around vulnerable customers has really come back into play for NGN and how we begin to tackle issues that are out there. We work with community partners, 9 community partners within our region who are engaged and have projects with NHS, doctors' surgeries. They also do benefits checking and that type of activity to ensure that customers get the very best out of engagement with NGN. And we do that through a process that NGN have adopted called Making Every Contact Count, which is where if our engineers go out to site and they engage with the customer and they identify vulnerability, whether that's a customer wanting to sign up on the private services register or they may need just that little bit of extra help, we're able to offer that onward referral service, whether that's be to Citizens Advice Bureau, whether it's for energy efficiency or to tackle fuel poverty, or whether it's, again, around community resilience, or whether it's carbon monoxide awareness. So we are really trying to be as holistic as we can to offer as many onward referral services as we possibly can for the benefit of all our customers. What we've found is that actually through our onward offerings, we've found a lot of, we've uncovered quite a lot of stones with regards to vulnerability existing out there that's been previously untouched, that hasn't had the benefits that they need. They haven't had the support from local authorities. They haven't had, you know, a warm home to stay in. They're unable to pay energy bills even, and having to make that stark choice between, actually, can I afford to put the heating on, or can I actually put a meal on the table this evening? And I guess as the pandemic increases, the one thing that's going to become more prevalent for us as a business is carbon monoxide. Whereas now, where people are choosing, or you know, through no fault of their own, choosing between the choice of heating, eating, or actually having a gas appliance serviced. And one of those things there is actually a service or routine maintenance is going to be way at the bottom of people's lists, you know, when you're faced with that stark reality. So some of the things that we're doing is through education, and that's engagement with schools, albeit it's been limited throughout COVID. So actually being able to offer that and engage with school kids who'll then go home and spread those tales, you know, spread those messages around the dangers of carbon monoxide, which has been really difficult through this pandemic for us to get those messages out. We've done connecting homes for health, so actually off-grid customers were able to offer a free gas service. You know, if they're on benefits or they're struggling to pay energy bills, if they're, you know, if they're using solid fuel, having to carry coal in, and or on oil, we're actually offering a free gas service in certain circumstances. We've all utilising our own employees to be able to make voluntary calls to potentially lonely customers or elderly out of hours, just to make those calls, just to make sure, you know, almost, you know, adopting a grandparent, for want of a better word, where actually, you know, they're just having 10, 15, 20 minutes, even if it's a 30-minute call with a customer, you know, or an elderly or isolated person, just to make sure that they're okay, just to make sure, have you got everything that they need? You know, and even in some instances now, we are offering care packages within the business. So actually our engineers, where they identify vulnerability on a doorstep, you know, and they're also identified that there might not be, there may be a need in that household, we're also able to provide you know, almost a week's supply of shopping that we can have delivered to customers' properties, you know, and it's only, you know, it's a dry staple foods, it's nothing fancy. There's a puzzle book in there for kids, you know, all that type of thing that really we need to do. So for us at the moment, but everything's digital, you know, or the majority of our conversation, the majority of our engagement is digital. But for us, we also recognise that there are a substantial amount of people out there who are digitally excluded. So actually, I guess for me is, it's a how could we offer that you know, a telephony service that's, you know, landline based or whatever it happens to be, that offers that almost AI triage service for a customer by using keywords that directs them to the service that they require. For NGN, is that an onward referral to debt advice or energy efficiency or, you know, carbon monoxide awareness, you know, or is it something else? And how do we offer that? So on the flip side of that, we talk about digital transformation. We're also in the process of building a vulnerability mapping tool. And within that is a raft of open source information around house types, EPC scores, fuel poverty, energy bills, all that type of thing. But actually almost opening that up to, and again, it's how could we almost verbalize that map for those who are digitally excluded, so that you're almost able to travel around that on the end of a telephone without having to visualize it. So again, potentially using AI or something like that actually triages and takes the user, or you know, or the service user to exactly where they want to be, whether it's a charitable organization, whether that's to our, you know, emergency service, whether it's for additional support, do they need additional food drop-in. Any of that is really valuable for us. And certainly around private services register, how do we get people to enlist on the private services register? We're working with a popular digital TV provider, and they're looking at actually including that form within a red button, you know, red button type service, which will allow the user to enlist on the private services register. We're also starting to look at training and accessibility within our own people, within our own organisation, whilst recognising that actually we need to keep everyone safe during this pandemic. So whilst we're able to deliver some training, a lot of that now has been adapted to being online. And it's how do we make that as useful, as insightful as we possibly can? How do we get across the messages that we need to convey that actually engages with our own people, so that they can go out and do the right thing whilst they're out in the public domain. We're also looking at identifying skills gaps now. So actually, in building towards the future, is where do those skills gaps exist? What can we do in local communities to try and close those skill gaps, whether that's through training or whether that's through an apprenticeship scheme, or whether that's, whether it's work experience for the younger community, anything that we can do to try and transform communities for the better, whilst trying to decrease crime and, antisocial behaviour and all that type of thing, can only be a good thing for us as a business. We're also working on a few projects, some of which have come out of COVID. Certainly Project Doorstep, which uses facial recognition, is a project that's underway, and we're using that to prevent, as we recognise that actually doorstep fraud and crime is on the increase. You've got a lot of bogus callers going around. People are vulnerable because everybody, or the majority of people, are at home. You've got busy households. You've got, there could be dogs barking and your kids are preoccupying you, and somebody turns up at the door, purveying to be, from a local water authority, and they're checking pressures, all that type of thing. So we're now building in a project that's called Doorstop, and that just uses a normal telephone with a web browser rather than being app based. But really, for us, it's about how do we contact customers who are digitally excluded, certainly to inform around the service offerings that we have, around the street works activities that are taking place that may cause interruption. How do we communicate better with those people, and certainly who are potentially digitally excluded? How do we increase uptake, and referrals internally via our normal customer routes, where we could open up additional benefits, unlock benefits via benefits checking? How do we keep the gas flowing so that we're not interrupting customers in vulnerable circumstances? So what innovative solutions are there out there that actually allow us to do our works, to replace mains or services, to carry on with our emergency activities without interrupting customers' gas supplies? Again, how do we increase per out services registrations? How do we improve carbon monoxide awareness out there? How do we reduce fuel poverty? How do we increase energy efficiency? How do we increase community resilience? And how do we increase digital inclusivity? And I guess with the other one of those where Jason was speaking about smart devices, is we're actually engaged with the manufacturer now to look at a smart device that can potentially detect carbon monoxide within the bloodstream, and that's a non-invasive test that actually is a wrist-worn device that hopefully will become really, really useful. And actually it's envisaged that actually that could save lives, certainly where people, customers are exposed to low levels of carbon monoxide over a prolonged period of time. All those types of things are, how do we do that? And actually, we've got ideas around how we could do it, but we need to engage with you guys out there, the NHS specialists, the developers, the smart tech people. We can't do this all on our own. And certainly the mapping tool, again, how do we, make that a one-stop shop? How do we make it a virtual world where there's no digital exclusion? How do we build in smart AI? How do we include that within a telephony service? There are lots of how do we's, and I suppose that's just the way of life, isn't it? How do we, but for me, it's all those things, and any help, is always greatly received. So I think I'm about done there, but thank you very much for your time, and thank you for listening, and I'll pass you back over to Sarah. Thank you.
Thank you so much, Steve. That was really, there's so much food for thought in that. And, really kind of excited by your passion in tackling the problem. And I know kind of our audience listening, these are big problems that we're throwing out there. There's a lot to digest in these talks that are coming through. Please do put any questions that you've got in the Q&A box. And what we'll also be doing is after today, particularly for those individuals who are watching this on the playback and on with us live, please do reach out if there's something you've heard within the talks that have taken place that you think you'd be well placed to respond to, but you need maybe a bit more information. Our team want to work with you so you can get the insight you need to put together a meaningful draft of a solution, and then obviously work potentially with either the challenge supporters who are here or other organisations that you might want to work with to test these out and see if the innovative ideas that you have really can work. So thank you so much, Stephen. Please do ask any questions in the chat box. And our final speaker that we'd like to invite is Steve Parry from NHS, giving us kind of an insight into the ongoing disruption that COVID has caused in our kind of vulnerable and elderly communities. So Steve, if you would like to take it away, I have your slides if you'd like me to share them, but you're welcome to share your own screen.
Oh, that'd be great, Sarah. If you could share, that'd be fantastic. I just clued I've shared many times on Teams, but I haven't shared on Zoom, so it'll be probably quicker if you do it. So in preparing this brief talk, I was asked for just a 5-minute quick overview. I've canvassed a lot of my colleagues in health and social care, and both providers and managers, commissioners and others, to see what they think are the main challenges. And of course, there are many in trying to provide healthcare in people's homes. There are many from an organizational perspective, from a funding perspective, but I'll try and hone down the ones that may be most applicable to you guys on this webinar, and ones where you may be offering some kind of assistance, if you like, with suggestions. And clearly from the previous speakers, there is much overlap between what I'm going to say and particularly Jason's talk. Next slide, please, Sarah. So communication is a key one, and communication, paper versus electronic. We have issues around cognitive impairment, learning disability, varying educational levels and language in certain communities, where communication is not as easy as you might think it would be. And there's also the increasing complexity of interventions, and this is a theme running through a lot of what's happening in community health services in the minute, is that large increase in complexity of what is being delivered in a community setting that used to be delivered in a non-community setting. And there's not just communication with our patients and with residents, it's how we communicate with other professionals. And you'd think that this would be, in this day and age, a very simple, easy thing. It really, really isn't. Systems just don't talk to each other, and never mind across health and social care as one example, but even within health, within GP practices, the one next door can have system one, the next can have EMIS, which are the two main sort of GP patient record database services. And then your secondary care systems all have their own bespoke systems as well. So it's incredibly difficult. And that, of course, leads to its own inefficiencies, much of which is around duplication of effort and the inherent waste that goes with it. So the theme of communication is a pretty large one, not least because not only do you want to deliver the best quality care, you want to be able to share it, not duplicate it, and you want your patients to be able to understand what you're doing. Next slide, please. And then it's the issues of actually working from a health perspective in someone's home. There's that complex intervention thing. There's the rise of assistive technologies, which are fantastic, but far from universally available, and far from well worked out in terms of how assistive technologies help the places they're going to help the most, and how people are going to assess the results of their use of assistive technologies. how we deliver specialist care at home. There are issues around how workers, and this will be across all your various sectors, but in health particularly, we're seeing a rise in the amount of violence and aggression that people are subjected to. There are, I've called it probity for want of a better word, but how are people best using their time? How are they managing to use their time to the benefit of their patient group without disadvantaging themselves in any way? And then there's the issue of equity of access to specialist care. Just because you're having your care at home should not mean that you don't get the same high quality care that you would expect if it was being delivered centrally. And around that home versus hub issues is the problems of workforce, which are many, but we have in many areas, in the Northeast particularly, an aging community workforce. There are many and varied issues around staff training and professional development, and these are places that other sectors, other ways of working may be able to help us in the future. Next, please. I've kind of put in the biggies that they're sort of writ large across the entire landscape, and I'll mention them very briefly because they're there and they smack you in the eye, whether you like it or not. COVID and investment. From the COVID perspective, there are many, many practicalities which are common to much of what many of you do. But there are also, peculiar to the community health services, a fairly dramatic shift since March from hospitals and from primary care. So both secondary care services and GPs are expecting more and more and more to be done by community-based services. I know GPs are in the community, but the emphasis on community district nursing, matrons, home care services is pretty dramatic and hasn't been matched by an increase in funding. And there's a great political rhetoric around, yes, transfer care into the community, but that's certainly not been matched by any remote funding increase that is consistent with that. Next, please. And so in summary, if I was to give two issues that really we need some fairly speedy help with, one is the broad IT area, both within health service teams and between health and social care professionals to enable better quality care that's done more practically, potentially cheaply, allowing more investment in better ways of doing things, a better and more evidence-based, I guess, use of assistive technologies to enable more complex and better care, as well as remote monitoring, which can be both the immediate face-to-face blood pressure, heart rate, etc., but longer term as well, falls prevention, long-term heart rate and blood pressure monitoring, that kind of stuff. So IT solutions, and then lean workforce. Again, I've called it lean for various reasons, but we need to keep our workforce safe. They need to be well trained. They need to be valued by the people they're looking after and by the organizations using their work, and ensuring, if you like, the best use of health and social care resource to get those maximal benefits. And that involves health and social care coming together. And there's an example of that currently locally in Newcastle. The Collaborative Newcastle initiative is joining together all players in the system to try and maximize the way that we share resource and people to enable better working. Thank you very much. I hope that helps a little.
Thank you so much, Steve. That was great. I will now pass across the microphone to my colleague Alison Freer, who will be leading the Q&A. Some really interesting things to consider with that. And thank you so much, Steve, for such kind of a concise summary at the end. I'm hoping that whilst this is a really complex problem, we're seeing really kind of shared areas of problem and areas in need of solutions that, you know, hopefully our audience who are watching this back will be able to identify those shared threads and be able to develop some solutions that we can support.
Well, thank you, Sarah. I hope everyone can hear me okay. And thanks to each and every one of our speakers so far. I'm sure I speak for many of you in this virtual audience, including my colleagues on the team. Really quite how humbling it is to listen to these stories from the front line. We're very lucky today to be all of us able to work from home. I think what each of you have raised this morning is the real ever-present challenges for people who are going out there to deliver on the front line. So if I might begin, and I think, and Christine, you have always been a great proponent of remembering the diversity of audiences that we need to think about. If any of the potential solution providers listening into this session today were to be working with any of your teams or customers in these times over the next 3 to 6 months, what would you want them to be aware of about how best to engage with some of these diverse audiences, be they team members or indeed your customers?
Thanks, Alison. I think if there was one thing that was consistent across the diversity of our customer base, our colleagues, it's I suppose it's the fatigue at this point in time, and you know, we're all facing that at the moment, isn't it? This has gone on for a long time. These challenges have been building up. We're feeling that from customers, we're feeling that from staff, we're feeling that personally ourselves. So yeah, it feels, I think, right now about, you know, understanding and putting yourself in people's shoes from that perspective, which probably isn't that difficult because we're all experiencing that. If there was a commonality, but yes, there's so much diversity across our customer base. Again, it's been quite an opportunity for us at Karbon to a certain extent, because we've been forced to really understand that even further, and we're looking at various things around segmenting our customer base to help with really tailoring our communications and needs, and similarly doing similar things with our colleagues too, so that we know that we're all together, but there is a lot of difference, and we need to understand that difference, you know.
Yeah, so some real granularity in the particular needs of different people in different communities and different demographics,
yeah.
Highlighted by many speakers. And Steve, Parry, if I could just come back to you on that point that Christine mentioned about fatigue. What would it mean, do you think, to some of your colleagues across the different health communities that you're working in to relieve some of this pressure in the next 6 months?
It's huge. I don't think I can possibly tell you how tired people are. Christine used that word. People are, I won't swear, but they really are really tired. And it's not just a physical fatigue. It's that mental strain, I guess, not just of dealing with the patient group. It's the PPE, it's the not being able to communicate, it's not being able to have the usual day-to-day physical interactions that you would have. Simple things like, I can't shake a patient's hand anymore. And it goes, every bone in my body rebels every time I see a patient and I can't shake their hand. And I know that every part of the system feels the same way. However, we all know that it is what it is, and you have to just carry on and do the business. But some relief in sight as the vaccine program unrolls is giving people a very sizable boost. and part of what I was talking about in terms of the need for better assistive technologies, better use of assistive technologies, better use of communication, better use of IT in communication is such a big part of this, because it does lessen the strain, it does lessen the burden, while providing a higher quality of care. And that's kind of the holy grail, isn't it? What can you do that's going to ease burdens for staff while making it better for patients?
Yes, so that win-win outcome, it's often easily said and very difficult to achieve.
Yeah.
Thank you, Steve. I'm going to say hello to Lisa Connell, who's kindly joined us online from Northumbrian Water Group, and Lisa's been listening in to the discussion so far. And so Northumbrian Water, another key organisation in our region, going into our neighbourhoods, localities, urban, rural, in all weathers, on all days of the year. Lisa, from what you've tuned into so far in this webinar, what would you now see as being some of the real cross-cutting challenges that you identify with in your organisation and for your communities?
Yeah, thank you for asking us to come along. Very much, I've joined and listened in and listened to Steve talking from NGN, and you know, when he went through his list of calls out for support, I was ticking down my list of going, they're all the same things that we're seeing. I think we offer a very similar kind of service in a way. Obviously, we're doing the water rather than the gas, but we've got those exact same challenges of reaching out to our vulnerable customers to get engaged with them, to get the trust and their ease of contact with us. I think that, you know, the slight difference for us is our need regularly to get in customers' homes when we've got things like leaks or we've got people with high consumption. How do we support them? How do we get them the trust that, you know, we're coming in? We've talked around the potential worry of bogus callers at the moment, and having that trust that, you know, a lot of the time we'd like to come in and resolve an issue for them, but actually, is there a way they can do that resolution themselves? Is there a way, is there technology that could help them to support that understanding their consumption, understanding that actually why that consumption is high, their bill's high. And that's another worry that they've got to think about. You know, as a business, we can provide them with discounted bills, but actually really want to solve the problem of why they're using excess water and what can we do to help them. So, you know, on top of all of the concerns we've got, helping them with that would be a real benefit for us so that they could self-serve and resolve problems.
And so within many of these challenges that various of you have described, I guess there's immediate response, and there's also long-term legacy. That you know, the phrase is perhaps overused, but how do we learn and come back stronger from all of this? Which and I'm sure we'll hear from colleagues at North East later on about that's part of the desire of this programme. If I could just come back to Jason at Beyond Homes, now that Jason, thank you so much for your input, and also as you've listened in to other colleagues speaking, you've clearly done a lot to try and respond and adapt and recover. What would you and your senior team love to be saying about what you've achieved by summer of 2021? And you might just need to unmute yourself, Jason.
I think we'd all like to be probably physically slightly more connected than we have been over the last 6 to 9 months. Go back to the point that Steve made there, we're all missing a shake of a hand and a bit of physical connection, and even in the organisational sense. You know, I think that whilst Beyond Housing has adapted unbelievably to pushing its workforce into a more agile, flexible home working model, and the speed at which we had to do that, I come back to, you know, the housing sector, housing associations in particular, are people businesses. We're here to provide services to customers and people, and we deliver those services through people working together as people. So some of that teamship and some of that on the ground rubbing of shoulders and conversations with the whites of eyes, it's not there as much as it was. It will never come back that way. But I think by the middle of next year, I think that we will, as an organisation, want to manage that balance, find that sweet spot organisationally, that we have we've probably transitioned into a more modern, mobile, agile, flexible organisation by way of staff structure, where they do their work from, how they work, but one which still allows sufficient teamship and interaction so that we can continue to be a senior team, a workforce, an organisation which is pure and simple, Alison, focused on delivering the best we possibly can to our customers, delivering directly what we're responsible for, and getting even better at working in partnership with other stakeholders, organisations, where there is that need to address issues which perhaps we can't deal with directly.
Yes, I really like that phrase, teamship. I think it's something we're all missing. I'm seeing a lot of nods around the faces that I can see. The irony is I heard a phrase, the human need to share the air with others. It's how we've communicated for centuries. And yet now that isolation is part of our common parlance, it's one of the most difficult things to attain. And in some cases, it's actually currently in COVID situations deadly. But yes, it's a tantalizing human need. I think this is something for those of you listening in the audience, I really want you to tune in to some of these factors, because all of it needs to be present. As many of people have said, it's not just about one piece of technology or a software platform. And if on that note, I want just to come back to you, Steve Dacre. You've described a whole range of different innovations that you and your colleagues have managed to implement over the last 9 months. Yep. What is it that, if you were to work with potential solution providers, you'd be wanting to see in terms of their ability to help you and others innovate?
I guess for me and for Northern Gas Networks is that we'll work with anyone. If we're heading in the same direction, and innovating, it's not about innovating for the sake of. It's about innovating to make the world a better place. It's about innovating to make accessibility not so much an issue. It's about that teamship that Jason spoke about. It's about actually we're all in this together, and as a utility, we're just one provider. But for us, innovation doesn't stop with nuts and bolts and with things in the ground. Innovation is around people, is around thoughts, is around trust and engagement, and it's how do we bring all those things together in one place for the better, for the benefit of not just business and not just, giant corporation, but this is for the benefit of the people on the ground. This is for benefits of members of public, for my family, for your families, for the future of everyone. We're innovating in spaces that perhaps we've not really thought of before, but COVID and the response to this pandemic has really brought out the best in people, as for all that we can, whether that's people are suffering Zoom fatigue, through constant Zoom meetings, or Teams fatigue, and you've not got that social contact, that's real social interaction, sharing the air that we all breathe, and as you say there, Alison, in some cases that could be really dangerous and in some, and fatal in some instances. But actually, it's about how do we overcome that as a population, as human beings? How do we all work together for the commonality, for the better good of men, women, and children, of all ages, of all vulnerabilities, of all varying needs? How do we make our services accessible for everyone? And whether that's through digital or whether that's through a telephony solution, or whether it's us working with Jason and Christine and other housing associations, actually we don't close the door to anything. That innovation is exactly that for me. Anything is possible.
Well, thank you. I don't know. I'm sure many of us could, despite Zoom fatigue, I think here is a really compelling movement starting. And before I hand back to Sarah to talk about next steps, we also have, I'd like to invite Alan Welby, who's from Northeast Local Enterprise Partnership, and just any closing comments on the panel before we hand back to Sarah for next steps. Just
Thanks, Alison. Nothing really from me. Just, I mean, I know you're now going to go into saying the nuts and bolts of the program itself, but just look, I you know, as somebody who sort of set up this program, I don't think there's any reason why you shouldn't be putting your expressions of interest in the if you're a solution provider. The form is very light touch. We want to see your ideas, how you can solve some of the problems that have been really articulated today really clearly. We're also quite keen to get a broad portfolio of problems, you know, easy solutions to some risky ones. We want to test and push boundaries. And for the solution providers who've been really clear today, I'm sure you're in dialogue with SMEs locally in the region. Let's get them engaged. Let's, you know, get people solving your problems. Let's use all the challenges and the horrendous stuff you've been talking about here as an opportunity for positive change. And we really want to support you to do that.
Thank you, Alan. I'm going to hand back to Sarah for some closing comments and next steps. So thank you everyone for all of that wonderful insight.
Thank you so much to everyone who's provided that. I think kind of just one thought from myself is that obviously listening to these, we've got the reason why we have focused on this area is because it's really a challenging area to focus on. It is, you know, these are problems that they may have been exacerbated by COVID, but they're not going anywhere anytime soon. COVID has just highlighted, you know, the complexity of care that our community members need, the challenges that we face as organizations as we are kind of, you know, delivering our services. How can we work together more effectively? And I think Christine highlighted in the chat, how can we work together to make sure that, you know, the users who we are all serving in various different capacities can access the help that they need. And there may be areas that you have been listening to as potential solution developers where you are thinking, there's one particular area there that I know that our organization or our team or myself could respond to really well. And you're welcome to focus on that. But also you may want to think about, we have a number of organizations here who have expressed shared threads of challenge. How could you maybe help them have that maybe shared visibility of the need of the communities that they are all working in? And how can you maybe then help with that signposting and that service delivery so that they can tackle these challenges for the future going forward? And we appreciate that you may not have all of the answers from having listened to this session today. There may be a little bit more discovery you want to do before you put in your application. Please do get in contact with us with the email that you have there on screen so that you can we can answer any questions that you provide that you have, or maybe get you in contact with the right organizations to ask a few more questions and formulate in your application. So our deadline for applications firstly is the 8th of January. So you have a month. That is now live on the website, and I'll be showing you where that is so you can start to formulate those. Anyone who is who's based in the Northeast LEP and is an SME or a consortia, a partnership of organizations led by a Northeast-based SME is eligible to apply for the funding if you've not exceeded the de minimis aid funding limit of €200,000 over the last 3 years. If you're unsure about that, do reach out to our team to discuss. If you're not eligible, and that might be because you are an organization that is facing these challenges and maybe wants to support the challenge and test out solutions, or maybe you're a larger organization, a research organization, and wants to maybe be involved, please do reach out and we can talk to you about how you can support these solutions being developed in maybe a slightly different way. This is effectively the timeline. So for any of you who've listened today and are interested, please do book in a one-to-one call with our team. Myself and other members of the team will be available to talk you through the challenge requirements, what we're looking for in an application, and to help bounce your ideas around. We will be asking you to submit an expression of interest via the link here that is now live and that my colleagues will be posting in the chat box for you to access. As I mentioned earlier, you can apply for up between £2,000 and £5,000 of funding, and that is exclusively for the development of your prototype between January and March of next year, and to test that prototype with some of the organisations or others that you might know who are represented here in the session today. And that is for your staff's time in developing that, or for any services that you need to contract in developing the prototype. It is, we aren't asking for a lot of reporting back. We aren't asking for a lot in our expression of interest form. What we really want to know is, who are you? What is your potential solution? Why does it address the challenges that have been outlined? What risks do you think there might be in developing the prototype in the timescale allowed, and how might you respond to those? And why is your team well placed to develop this solution? So very light touch, and I'll show you the form in a moment. You will be able to tap into our experienced business and innovation specialists to get the support that you need to rapidly develop a prototype that actually demonstrates the potential impact of your solution. And also we want to know in that application, you know, what is it that you need from us during that period to be successful? You know, what connections do you need to challenge supporters? What maybe insight to their user's journey do you need to ensure that you are developing something that has impact? What data sets can they provide to you that you'll want to build into your prototype to demonstrate how it might work once it's been developed further? And the only requirement for getting that funding is that you submit a pitch at the end of March, pitching the prototype that you've developed and demonstrating kind of the impact that it's had and what your proposed next steps for it are. And from that pitch session, we'll be advising you whether or not you are suitable to go forward for a larger fund of money between £10,000 and £40,000. Again, like the prototype funding, 100% funded. You don't need to source any match funding or provide any additional funding for that, to develop those most innovative solutions going forward, to take them forward and roll them out. The full details are available at the website. The link is there. But like I said, after today, please do reach out to us. We'll be circulating this recording. Please do make collaborators or other organisations in the Northeast aware that this programme is going on. This has been a very rapid turnaround because everything with COVID has been, and we'd really value your help in getting the message out there. I think that kind of mission statement is really kind of evocative, that how do we work together to make sure that the communities that all of us are serving get the support that we need. So this quickly here is, once you go on the website, you will see challenges 1 and 2 that are now live. If you click through to that, you will be able to, once you click onto the challenge 2 page, you'll either be able to book in a one-to-one with us, or you'll be able to access the expression of interest form to start populating that if you are so interested. And this is the form itself here. Like I said, relatively light touch, very short introductions, with some guidance on how to do that there. Basically, what is your solution? How does this respond to the challenge? Who are you and why are you well placed to do this? And basically, you know, what do you want the money for? If you have any questions, please do reach out to us. Our email address is there. All of our team are really excited to work with you. Like I said, this is a really complex area, but we're really keen to have your support in it and to work with you to get you onto the programme if you've got a really good idea, and to help you work with these organisations who've given up their time today and are really passionate about addressing the most pressing needs of our community. So thank you for your time. Thank you to our speakers. Thank you to our team who have helped get us to the stage that we're at today. I'm really grateful for all of your input from everyone who has either spoken or has taken the time listening today, or will be helping us to spread the message of this challenge further. We really look forward to hearing from you and to hearing how you can develop the solutions that are going to make our region stronger and help the most in the communities that we are trying to work with and for. So thank you again. And we hope that we will be hearing from you with your ideas and your support for tackling this. Thanks again.